Alright now, Mr. Smith, I have you all connected to the monitors. In a few minutes the doctor will come in and we will get started. I will be giving you some sedation medicine through your IV. So your job is to just relax.
Finally. Here I am, let's get going. Chop, chop. I have a 2 o'clock tea time with those medical device reps. Did you know that I don't even play golf? Really, I'm only good just to drink and then get smashed.
Doctor, please. The patient is probably able to hear you. This conversation is not appropriate. Please change the subject.
Nurse, how's our patient doing? Look at his blonde hair. Wow, he really looks like Donald Trump with that comb over. Don't you think, nurse?
Doctor, the patient is still awake and can hear you. Mr. Smith is doing all right. He is connected to the monitor, and I am monitoring his vitals very carefully.
Are we about ready to start this procedure? By the way, what are we doing anyway?
Are you kidding me? You must be joking.
I was out late last night.
You are placing an implanted port so that Mr. Smith can begin his chemotherapy.
Well, that sounds like a plan.
Okay. Are you feeling well enough to proceed?
Of course.
So then, are you ready to do a procedure timeout?
What for? Let's just proceed. That's not important. I don't have time for this nonsense.
But doctor, you know this is a hospital policy that we must perform a timeout before we begin. This is to keep our patients safe.
Who comes up with this stuff anyway? Probably those monkeys in suits upstairs sitting around thinking up new policies and procedures just to make my life more difficult.
I understand your frustration. However, this conversation is not appropriate with the patient right here. You know the reason why we do a timeout before the procedure. This is nothing new. Are you now ready to proceed?
Yeah, whatever. Mr. Smith doesn't look very sedated. He still looks wide awake.
Well, that is because I haven't given him any meds yet. As soon as we finish the timeout, I will then sedate him.
Fine. Well, nurse, hurry up.
Very well, doctor. The timeout is completed.
Make sure you double up on that dose. Let's get going. We have wasted enough time with all this timeout BS.
Doctor, I realize that you like your patients to be completely sedated or more like snowed.
Well, I don't like them trying to jump off the table during the procedure.
Mr. Smith is resting quietly with his eyes closed and is able to respond appropriately. I think it is safe to begin now.
Look, he's moving his finger there. He definitely needs more sedation.
He looks comfortable. Remember, just as we discussed before this procedure, Mr. Smith's vital signs have been very unstable. His blood pressure has been running extremely low, despite all the fluids I have given him. His heart rhythm is all over the place and he is having frequent PVCs.
What is that noise? Can you turn it down or off?
I am not comfortable giving this patient any more fentanyl with all these PVCs. Do you not hear that alarm on the heart monitor that keeps going off? He just had a run of 13 PVCs.
Just give him more IV sedation. Make it stat 2.
You are aware that you are asking me to kill him, don't you?
I do not care. I do not want him to move or talk or anything.
He isn't stable enough to tolerate any more sedation medication. His blood pressure is 72/44. His heart rate is 38.
Nurse, that is an order. How much sedation IV medication has he even had?
He has had 4 milligrams of Vicodin and 200 micrograms of fentanyl.
He is fine. Just give it. Why do you have to argue with me? Why, you ask? Because I said so. I am the doctor.
Doctor, I am not comfortable with the order you are demanding that I give this patient. I have explained my reasons for not being comfortable with giving any more sedation medication.
Say what? Why not?
I explained to you that Mr. Smith's blood pressure is 72/44. His heart rate is in the 40s with frequent runs of PVCs. He is on 4 liters of oxygen with his saturations barely maintaining 90%.
Why didn't you say anything? I don't remember you saying that. Well, in that case, do not give him any more sedation medications.
Exactly. He is not tolerating these medications at all. I really wish you would pay more attention when I speak to you. How do you expect me to keep our patients safe when I can't count on you to listen?
I'm sorry, I have not been paying attention to everything you have been saying. I have had a lot on my mind.
What, like your golf game?
You're right. It would not be in the best interest of our patient to proceed with the sport. If he is not able to tolerate any more sedation, then I think we need to terminate this procedure and try again at a later time.
Perhaps maybe when he is a little more stable.